Everybody cares about healthcare. It ranks as the number one issue leading into the provincial election. But what should we be asking of our politicians? All across Ontario, patients are waiting in hallways, in storage closets, even in shower rooms on stretchers because our hospitals are so overcrowded there are no beds available to admit them into. Ontario hospitals are funded at the lowest rate of any province in Canada. We are 14,000 beds short of the average of other provinces. In Ontario, 34,000 people, mostly elderly, often with conditions like dementia and Alzheimer's, are waiting for a bed in a nursing home. Ontario needs two commitments leading into June 7th's provincial election. Number one, an immediate and significant infusion of funding is needed for Ontario's public hospitals. The Coalition is asking for 5.3% per year based on the best evidence available and a commitment to get that money directly to care, not to executive salaries and administrative functions that do not support increasing care levels. Number two, a commitment to open 30,000 new long-term care spaces as quickly as possible to address the waitlist of 34,000 people and improve care levels so every nursing home resident gets a minimum average of 4 hours of direct nursing and personal care per day. As Canadians, we're proud of our public health care that has served us well for a generation. The problem is not with public health care, but with decades of downsizing and cuts to it. This election, we can make a difference. Let's tell all the politicians of all political stripes it's time to stop the cuts. It's time to rebuild.